Hi guys, I just wanted to create this video to give you a reference of the blood work that we're going to be looking at, to make sure that you know exactly what this blood work means and how to interpret it. Now, of course, I always recommend that we go over it together or that you go over it with a trained medical professional, but I wanted to give you this guide to make sure that when you do either go over this blood work with me or someone else, that you had a reference point of what it all means. So we're going to go through all this blood work. And as we do, some things to keep in mind. Depending on the lab you use, if you use LabCorp or Quest or Vibrant America or some other lab, this may be in a little bit of a different order, but it's going to be the same information, So don't worry too much about how we do it, because you can pick and choose in this video where you need to go. So you could find the information very easily. Also, something to understand before we get started is the reference ranges. So you'll see some reference ranges on the right-hand side of the page. And it's important to understand that these are not optimal reference ranges. These are standard American reference ranges. And something to understand is these reference ranges are very broad sometimes, and that we are, in functional medicine, me personally and people in my profession are looking for more tight reference ranges. So I want you to, per se, not pay attention to the reference ranges on the right-hand side, but more, I'll tell you what my reference ranges are. Because even if it may say it's normal and within the reference range, but it may not be in my reference range. So you'll hear me making reference to what I'd want it to be. So let's get started from the top and work our way down. And I'm going to basically tell you everything you need to know about each lab variable. All right, the first thing we're looking at on this page is ferritin. Ferritin is the storage form of iron. It's stored in the bone marrow, muscles, and liver. And iron is what carries oxygen throughout the body, but it also feeds mitochondria. So if someone's anemic and has low iron, they're going to be very depleted and feel pretty terrible. One, because they're not carrying oxygen throughout their body, and two, they're not feeding their mitochondria, the powerhouse, the energy producer of every cell in their body. So that's why iron is so important. So it's really important that you get your iron checked, but also your ferritin, the storage level of iron, checked. So in this example, you can see the ferritin is 38. And this is a female we're talking about. So in a female, I would love to see a ferritin between 80 and 100. And for a male, I'd love to see it 100 plus, 100, 150, even 200 sometimes. Once a male gets into above 200, that's a sign of chronic inflammation. So low ferritin, so in this case, in a female, 38, again, is below 80. That's a sign of low ferritin. Again, anything above 100, 150 for a female would be considered high ferritin. So a low ferritin usually presents with fatigue, brain fog, kind of depleted because your body doesn't have the storage form of iron that it needs. And then, therefore, your body's not carrying oxygen as well as it could and not feeding mitochondria as well as it could. Your body's not producing energy as well as it could, so you're going to feel depleted. If you Google low ferritin, you're going to see a lot of symptoms, and majority that you may have with a ferritin this low. So low ferritin's a big deal. But you'll notice the iron is normal. So what this means is the body's producing iron, it's absorbing iron, but it's not putting it into storage. And generally what that means, or could mean, is there's a lack of vitamin C. Vitamin C helps put iron into storage. So something I would recommend for this person is that they start taking a vitamin C supplement to help drive that iron into storage. Because if you're producing iron normally and then you have a low ferritin, what it means is during periods of stress, your body's going to start to fall apart more. You may be okay when things are okay, right? When you're doing okay. But when you're under physical, chemical, or emotional stress, then your body starts to fall apart because you don't have the reserves. So one thing I would recommend for this client is to make sure that we're using vitamin C to help push the iron into storage so that they have reserves of iron. And remember, if the ferritin is high, that means that's a sign of inflammation. So if we're looking at this and we see a high ferritin, we need to make sure that we're addressing all causes of inflammation. So high ferritin equals chronic inflammation problems, and then low ferritin equals lack of iron storage. Next, we're looking at folate, vitamin D, and B12, huge key nutrients. Now, there's multiple other nutrients that we'll test throughout this blood work, and multiple other nutrients that we'll test moving forward, or should test moving forward. But these three in particular do 400 different things. Each one of them does 400 different things in your body. So folate does 400 different things. Vitamin D and B12 all do 400 different things in your body. And they're involved in 400 different things, right? They're called cofactors. So folate, or vitamin B9, I'd like to see above 20. So this person you'll see is above 20. If your folate is below 20, I'm going to work on getting your folate up using either a methylfolate, and it's very important that it be methylated in most cases, and we'll explain more of that as we go. Also, we'll talk about nutrition. You should get your folate also through food, mainly fruits, vegetables, lean meats. Vitamin D, I'd like to see that between 60 and 80. In this case, you see this person's at 37.7, so a low vitamin D. Again, I encourage you to Google low vitamin D and the symptoms that you're going to experience, but they're kind of across the board, because vitamin D, just like folate and B12, have so many different things that they're involved in, 400 different things, that the symptoms are very general and very vague, including fatigue, chronic pain, brain fog, a lot of general symptoms. So again, I'm going to recommend this person get vitamin D through food, get vitamin D in a supplemental form, and make sure they're getting good amounts of sunlight. B12, kind of famously known as that energy-producing vitamin. I'd like to see that above 1,000. So you'll see this B12 is at 531. So again, because it's low, and remember the reference ranges, right? It says 232 is still normal. If I saw a B12 at 232, that is drastically low. So I want to make sure that the B12 is above 1,000, because generally the most common thing I see with a low B12 is some type of fatigue. So we want to make sure that we're, again, have a good amount of B12 and B vitamins in our body. And the thing about B vitamins is they're water soluble, meaning that you can't overdose on them. So if you see it above 1,000 or even 1,500 or something like that, it's nothing to be concerned about, because it is water soluble. So vitamin D, B12, and folate, I'd like to see the folate above 20, the vitamin D 60 to 80, and the B12 over 1,000. Total IgA. Total IgA is an antibody. Antibodies fight antigens. So antibodies are kind of the good guy, the soldier, the fighter of your body, of your immune system. And antigens are the bad guy, virus, bacteria, parasite, something that shouldn't be there. So IgA is an antibody of the gut, of the gastrointestinal system. So in a perfect world, I'd like to see this number between 100 and 190. If this is above 190, it's telling me that your body is triggering your immune system to come fight, specifically in the gut area. So if you're dealing with gut issues and you see this number above 190, it's telling me, this lab is telling me that your body is fighting something. A stool test is truly what's going to tell me what it's fighting. So this is just telling me that it's fighting something, but the stool test, a microbiome test, would truly tell me what it's fighting. Virus, bacteria, parasite, candida, something like that. Food allergies, food intolerances. It's fighting something, or you're consuming something that's causing your immune system to flare. So I need to make sure that this number is between 100 and 190. If it's above, if it's above 190, that's a pretty clear evidence that we're dealing with something. But you can still be dealing with something even if your number is normal. So you'll see in this example, this person is 143, but they're still having gut symptoms. So how is that possible? So the gut is a tube-based system, and the blood, which we're testing, is on the outside of the tube. right? So there shouldn't be blood on the inside of the tube. You shouldn't have blood in your stool. You shouldn't have blood in your stool. So this blood is only seeing the outside of the system. The reason the stool test is so important because that's what's going to show the inside of the system. So what this is telling me, and this is a good thing, is that the outside of the tube is okay. It's containing, whatever's going on inside. If you have a leaky tube, or if the tube is starting to break down and starting to fall apart, then stuff that's on the inside of the tube can start leaking out into the outside of the tube, and that's when the blood starts picking it up more and becomes more of a problem. So in that this number is normal, it's telling me most likely that we have a good contained system, but it doesn't mean there's not a problem on the inside of the tube. So we want to make sure that the stool test is done to make sure we can see the inside of the tube, because the blood is only showing the outside of the tube. So make sure you do that stool test as soon as you can. Celiac genetic panel. So you'll notice on this example, there's a double negative, meaning that they do not have celiac disease. And celiac disease, again, is a issue where you cannot digest and absorb gluten, and you have an actual immune response, autoimmune response to gluten when you consume it. So this person does not have celiac disease. Some people may have a 1 negative, 1 positive, and some people may have a double positive. So if you have a negative positive, that means you have 1 gene positive for celiacs. That means you do not have celiacs. You do not have celiacs. But you have 1 gene positive, which I see makes people more sensitive to gluten and dairy. That's really important, gluten and dairy. And why do I say dairy? Because dairy is molecularly very similar to gluten. So if you look at gluten and dairy underneath an electron microscope, they'll look almost identical. So when your body consumes gluten or dairy, it can't tell the difference. So it's going to have the same response. So if you're gluten intolerant, most likely you're dairy intolerant, and vice versa. If you're dairy intolerant, you're most likely gluten intolerant, because your body can't tell the difference. And if one's a problem, generally the other will be a problem. Generally, not always, but generally. So there's double negative. That, what I just talked about, was negative positive. And then there's the double positive. Now, that still doesn't mean you have celiac disease. Really, the only way to truly test for celiac disease is doing a biopsy of your intestines to see, and looking at underneath a microscope to see if there's damage and signs of celiac disease. But if you have double gene positive for celiac disease, more than likely you are significantly gluten intolerant and need to be staying away from gluten and, in my opinion, dairy. Anti-CCP3, IgG, and IgA. This is a marker for rheumatoid arthritis. I'd like to see this number below 7. When I see this number above 7, that does not mean you have rheumatoid arthritis. If I see the number above 40, that is a sign you potentially have rheumatoid arthritis. But you also have to have symptoms, right? Joint pain, muscle pain, chronic inflammation, things like that. But if I see the number above 7, it's telling me that there's processes in your body that are triggering an autoimmune response. So again, if you have a number above 7, it doesn't mean you have rheumatoid arthritis, but what it does mean is you have a autoimmune process happening that could potentially turn into rheumatoid arthritis. But more importantly, I have to figure out what is triggering your body to react in that way. And that's truly what I'm trying to do, is figure out the why behind all this. So if something's high, and not in just this case, but all cases, if something's high or something's low, I need to figure out why. So you'll notice in this example, this person has a 10. So again, above 7, but not above 40. So this is not a rheumatoid arthritis diagnosis. This is just a sign that she has some inflammation and some processes going on that then cause her immune system to get triggered. So we're going to figure out why. And you're going to see as we go through the rest of this labs, what may be triggering this. Nutrient deficiencies, we talked about that. She's low on vitamin D, B12. She's low on vitamin C from the ferritin, right? So all these things can trigger the immune system to become dysfunctional. So as we fix all these things, the immune system will hopefully fix itself. HSCRP, high sensitivity C-reactive protein. This is a protein produced by the liver in the face of stresses to increase inflammation. So something you have to remember is inflammation is not a bad word. If you twist your ankle, you want your ankle to blow up and get big because that means it's healing. If you get hurt, you get cut, you have a bruise, you want to make sure that an inflammatory process is happening to heal you. So that's all normal. Inflammation at certain points in time is normal. But if you didn't twist your ankle, if you didn't get an acute injury and you have inflammation, that's when it's a problem. So HSCRP is looking for more acute inflammation. And I'll add to see this number below 1. And you'll see in this example, she's at 0.8, which is good, which is telling me not that there's no inflammation, but there's no acute or new inflammation happening. You can still have chronic inflammation. You can still have problems, and you can still feel inflamed and have this number be normal because it's not acute, it's not new. So we're going to keep an eye on this and make sure that as we start fixing things, your body doesn't respond poorly. But something to understand is, if you've tested this before and it was normal, and now you tested it again and it's high, and if you've made some changes to try to fix some things, you may notice there's some inflammation starting to happen because your body's turning on and trying to fix things. Also, if you work out a lot or do a lot of muscle activity, again, your muscles are going to tear down and break down, and your body's going to need to produce inflammation to heal those muscles. So there's natural things that cause this number to rise. So don't be too concerned if it gets high. We'll talk about it, and we'll make sure we put all the story together to see why it's high. It's when it gets high for no known reason, that's when we need to be concerned, and that's when we need to start digging deeper. ANA, anti-nuclear antibody. So let's break that word down. Anti means against. Nuclear in this case means nucleus of a cell. Every cell has a nucleus or a brain. An antibody or fighter. So against nucleus antibody. So what that means in plain English is your body, if this is positive, if you have a positive ANA, your body is producing antibodies to its own cells. So your body's producing fighters or soldiers against itself. So this is called an autoimmune response. In this case, this person's negative, but if this comes back positive, that's a sign that your body's producing antibodies to its own cells. And this is a problem because if this keeps going on, then your body will start to break down, and this is where autoimmune disease starts to happen, such as rheumatoid arthritis, lupus, Sjogren's. There's so many different types of autoimmune disease, ulcerative colitis, Crohn's disease, so many different types of autoimmune disease going on. So we need to make sure that this is negative and stays negative. If it's positive, we need to find the reason why. What is triggering your body to create antibodies to itself? That's our goal, is to figure out why. And again, as we go through this blood work, we're going to find more and more reasons, such as nutrient deficiencies, hormone imbalances, gut issues, toxins. There's a lot of reasons why your body can start producing antibodies to itself. But if this is positive, we need to start digging deeper to figure out why it's happening. dsDNA. This is another antibody to your own tissue. In this case, your actual DNA. So if this comes back above 12, this is a sign that your body's producing antibodies to its own DNA. Now, if you Google this, this is a marker for lupus. Now, if you're above 12, I'm not saying you have lupus. But what I am saying is your body is producing antibodies to itself because of a stress, and it's our job to figure out what that stress is. It's producing antibodies to its own DNA. And again, if that continues to happen, you may develop lupus, or you may develop some type of other autoimmune disease, or your DNA may start to break down, and that can cause massive dysfunction in your body. So if this number's above 12, we need to figure out why and continue to monitor it to make sure whatever we're doing is moving that needle, is taking that number down. Cardiac panel. So first thing we're looking at in a cardiac panel is triglycerides or free-floating fatty acids. Also, triglycerides help make up cholesterol. They're a piece of cholesterol. I'd like to see this number below 150, but even better, I'd like to see it below 100, below 100. So in this case, you'll see the triglycerides are 99. Again, good, but right at that kind of borderline, right at that borderline. So again, 150 is the high watermark, but I'd really love to see it below 100. So something we're going to talk about is maybe even lowering these triglycerides a little bit more. One thing to understand about triglycerides is blood sugar and carbohydrates can cause the triglycerides to rise very high. Also, fats can do that too, and eating cholesterol, consuming cholesterol can cause your triglycerides to rise, but even more than cholesterol and fats in foods, blood sugar, carbs, consuming carbohydrates, consuming sugar, and having imbalances in your blood sugar can cause the triglycerides to rise even higher. So if you have high triglycerides or even high normal triglycerides, something we're going to talk about is making sure that your blood sugar, if anything, is balanced out. LDL direct. So there's two types of LDL that you can test. You can test calculated LDL or LDL direct. And I prefer LDL direct because that's an actual count of your LDL, where LDL calculated is more of a calculation. And something I always say is, I don't like math in the human body. The human body is not black and white. Math is very black and white. It's numbers based. The human body is very shades of gray. So I want to make sure that whatever we're testing in the body is counted directly and not an equation. So LDL direct is the better test for LDL. And I'd like to see that below 100, below 100. So, and you'll see in this example, she's at 142. Again, blood sugar can have a huge impact on LDL cholesterol. Just like triglycerides, so can eating fats and eating cholesterol-based foods can raise your LDL, but so can blood sugar. So we want to make sure not only we're watching, making sure we're eating good fats and not processed fats, but also watching blood sugar and carbohydrate consumption. Another thing to understand about LDL is LDL is not a bad word, and it's been demonized over the years. Cholesterol's kind of been demonized as, high cholesterol is going to make you have a heart attack or a stroke. And that couldn't be further from the truth. Cholesterol is the backbone of your body. It does so many different things. Cholesterol is what helps make cells. It produces the outer layer of cells. Every cell has cholesterol backbone. So you have to have cholesterol in your body, and it has to be there to make sure your body heals. Cholesterol also helps make all your hormones, or the communication system of your body. So you don't want your cholesterol to be too low or too blunted, right? You want to make sure you have good amounts of cholesterol to heal your body. Also, your brain is made majority of fat. So you have to make sure that you have good levels of cholesterol. And some people need more cholesterol than others. So it's really not a good idea to blanketly say everyone should have a cholesterol of this number or that number. But sometimes high cholesterol can be a problem for some people. So I need to figure out, is this a problem for her and is this a problem for you? And the way I do that is by doing two tests. Number one is something called a calcium score. And a calcium score, all that is it's a specific X-ray of your chest looking at the plaque, or specifically hardened or calcified. It's called a calcium score because it's looking at calcified plaque in your arteries. So it's a specific X-ray looking at the coronary or heart arteries to make sure that you don't have any calcified or hardened plaque in your arteries. So that's one test that I would run to see if this is a problem. Number two, another test that I would run is something called a carotid ultrasound. So this is an ultrasound of your carotid arteries, and what it's looking for is a couple things. Number one is it's looking for inflammation of your carotid arteries, because that can be a sign of impending heart attack or stroke, so risk of heart attack and stroke. Also, what it's looking for is plaque in your carotid arteries, which increases your risk of stroke, but also heart attack as well. And something a little bit different is that the carotid ultrasound allows me to see soft plaque. So I can't see soft plaque. I can only see hardened plaque with the calcium score. But the carotid ultrasound allows me to see soft plaque. And soft plaque is actually more dangerous than hard plaque. So I like doing both of these because if you have soft plaque in your carotid arteries, then you have soft plaque in your heart. And we have to address that immediately. Soft plaque is more likely to tear and bleed and clot, where hard plaque is kind of like stone. It's taking up space and increasing risk of heart attack and stroke, but it's not going anywhere. It's not going to rupture. It's not going to bleed. It's not going to clot. So soft plaque is actually more dangerous than hard plaque, but you can get rid of soft plaque where you can't really get rid of hard plaque. So we need to know, is it soft plaque? Is it hard plaque? And if you do have soft plaque, again, that's more dangerous, but we can get rid of that with things that we'll talk about throughout your program. Apolipoproteins. These are the ships that carry cholesterol from place to place. So first thing you're looking at is ApoA1. So this is the ship that carries HDL, or good cholesterol. So I don't do a lot of HDL testing. I more test ApoA1 because it's been shown that this is a little bit more accurate representation of good cholesterol than, and the effects of good cholesterol as opposed to just a pure HDL test. So we want to see this number a little bit higher. I like to see this number above 150, even 160 or above. So this is the ship that carries the good cholesterol, and good cholesterol takes plaque out of the arteries back to the liver for reprocessing. So that's what makes it good, and that's why they call it good cholesterol. ApoB, on the other hand, is the ship that carries the bad cholesterol. And I use the air quotes bad because remember, we just got done talking about LDL, how that's not bad. Unless it's plaquing, unless you have major issues in your arteries, which we'll see in a calcium score or a carotid ultrasound, if you have no plaque in your arteries, then who's to say that the cholesterol levels are bad or a problem? So before you go doing anything drastic for your cholesterol, make sure you get a look inside your arteries. And if they're not plaquing, you don't need to worry about it. ApoB is the ship that carries the LDL, right, cholesterol. So, and this has been shown to be a more accurate representation of LDL alone as well. So we want to make sure the ApoB is not out of control. Again, we will judge that based on the calcium score, and we'll judge that on the carotid ultrasound. But if we see plaque in your heart or in your carotid arteries, we're really going to want to make sure that this ApoB is below 80, right? So we need to make sure first, is it plaquing or not? If it's not plaquing, then we're going to be less aggressive with this. But something to understand is just because it's not plaquing now doesn't mean it'll never plaque. So we have to kind of weigh this. Do you have risk of plaquing? Do you have family history? Do you have high blood pressure? Do you have high blood sugar? So we'll make that determination as to what we need to do about it moving forward. But if there's risk and if you have plaque in your arteries, I'd want to see this ApoB below 80. And then you have the ApoB to ApoA1 ratio, which is the good cholesterol to bad cholesterol ratio. And again, we want to see a higher good cholesterol, a lower bad cholesterol. So we want to have a ratio above 0.5, or excuse me, below 0.5. So we're going to base all this off of all your history and based it off imaging studies as well. Inflammation. So there's a lot of different signs of inflammation, and a couple ones we're going to test right off the bat are something called PLAC. It's also called LPPLA2 in other lab work, so you may see LPPLA2 if you're looking at another lab, but PLAC is another way of talking about it. And this is artery and vein inflammation, And I'd like to see this number at about 150, 160. So you'll see in this example, this person's at 195, which again is theoretically normal, but I would say this is high normal for where I'd like it to be, So this is a sign that we have some inflammation in the arteries and veins, which can increase risk of heart attack and stroke. Again, if an artery is inflamed, the body's going to want to try to heal it. And one way the arteries try to get healed, or the body tries to heal an artery, is by laying down plaque. So the more inflammation you have in an artery or in a vein, the more likely plaque is going to start to lay down to try to heal that artery. So we want to make sure we lower that for just to decrease overall body inflammation, but also to decrease risk of heart attack and stroke moving forward. Homocysteine is cellular inflammation, cellular, so every cell in your body. If this is above 8, so I'd like to see this number between 6 and 8, between 6 and 8. If this number is above 8, that's a sign of cellular inflammation. So you'll notice this person's at 9, which again is not drastically high. 10, 11, 12 and above, that's where I consider it getting really high. But that's a sign that her cells and your cells are not working as efficiently or as effectively as they could. And generally, one big reason I see this happening is a lack of B vitamins, specifically methylated B vitamins. So if you go back, you remember that this person had low B12. But also, this is a sign, this is another sign I use to tell me that she probably has potentially low B1, B2, B3, B5, B6, B7, you get the picture, there's multiple Bs, but then there's also other nutrients that she may be deficient on in seeing this: magnesium, zinc, several others, iron, vitamin C, vitamin D, there's a lot of different things that go into this, and nutrient deficiencies are one of the biggest things I see. Also, genetic mutations, most famously something called MTHFR gene mutation, but there's a lot of other genes that deal with this homocysteine in particular, and we can talk, we'll talk more in depth if we need to at your visit about this. Oxidized LDL, so this is how fast is your cholesterol hardening. So you need cholesterol in your arteries, and you need it to harden. Because cholesterol, if you remember, heals the arteries or helps heal the arteries. So, and cholesterol is waxy, fatty, oily. So it has to harden to produce a shape, So you don't want this number to ever be 0, because then your arteries will never heal and the cholesterol will never take shape and you'll be in big trouble. So you never want this to be 0. You want it to be below 60. But if it's above 60, that's a sign that we have some faster oxidation or some faster hardening, which increases risk of the cholesterol building on itself and producing an eventual plaque that will cause a heart attack, stroke, blockage of some type. So you want to make sure we lower this. And the best way to lower this is by taking away as many inflammatory factors or as many stresses as we can. Optimizing nutrients, fixing any gut issues, fixing any hormone issues, getting rid of as much stress, chemical, physical, emotional, as we can. And then there's also supplements that we can use to help decrease inflammation, such as curcumin or turmeric, but also just, cinnamon. There's so many different, but even vitamin D and B vitamins can help with inflammation as well. Lipoprotein markers. So one marker we look at is the size, shape, and production of your cholesterol. So SD-LDL, or small dense LDL, is a big marker that I like to look at, because this is telling me the size, shape, and production of your cholesterol. So SD stands for small dense LDL. And when it comes to cholesterol, we like our cholesterol to be big and fluffy, not small and dense. The more small and the more dense a cholesterol is, the more dangerous. The more it can penetrate the artery, the more it can cause arterial inflammation, the more plaque it can create. So I like to see this number, below 45, below 45. So if you're below 45, that's great. If you're above 45, we need to do some things to help change the size, shape, and production of your cholesterol. And there's a lot of different things we can do, including lifestyle, supplementation, and medication if we need to. Again, if your arteries are full of plaque and you have a lot of inflammation and you're on the verge of having a heart attack or a stroke, we have to be aggressive. If that's not the case, then we don't need to be as aggressive. So it's a case-by-case basis, and it's very individualized. Lp(a). Lp(a) is a genetic marker of how much cholesterol you're producing from your liver. So you'll see in this example, they're at 168. I'd like to see this number below 7. So this is extreme. So this person has genetically very high production of cholesterol, which makes her more at risk for having a heart attack and a stroke, but also makes it a lot harder for her to control her cholesterol with diet, exercise, and potentially supplements alone. this may be a case, again, maybe a case where we might need some medical intervention to help with this, because this is genetic. No matter what she does, again, eating right, exercising, taking proper supplementation, fixing all other things may help, absolutely may help. But she still may be in an issue. She still may have issues moving forward, because this is purely genetic, and we cannot per se change her genes. So we'll see, making some relatively mild interventions, diet, exercise, supplements. If this helps, great. If she doesn't have any plaque in her arteries, great. But if she does, we may want to talk about medical intervention. Hemoglobin A1C. Hemoglobin A1C is a 3-month average of your blood sugar. So there's a lot of ups and downs with blood sugar. You eat, you fast, you're stressed, you're not stressed, you exercise, you don't exercise. There's a lot of different reasons why blood sugar can go up and down, and depending on what you eat and all these different things. So this blood panel allows us to look at a 3-month average of all those ups and downs. And the way they do that is because red blood cells carry hemoglobin, and then hemoglobin carries blood sugar. And a red blood cell lives about 90 days. So that's how they can extrapolate this data. This is how they can get a 90-day or 3-month average of your blood sugar. And I'd like to see this between 4.5 and 5.4. So you'll notice in this example, she's at 5.3, which I'd consider pretty perfect, pretty good. But again, it's an average, so it's hard to tell, with all the ups and downs. There might be some really low lows, and there might some really high highs. But if you look at kind of the average, it looks normal. So this is a good test, and it's important to get done, but it's not the end-all be-all of blood sugar. You really need to look at the whole picture, and insulin is another piece of that picture. So anytime you're testing blood sugar, whether it be hemoglobin A1C, glucose, you need to be testing insulin as well, because insulin is the hormone that allows the blood sugar to go into the cell, to activate the cell, to feed the cell so that the cell can work. So we want to make sure the insulin is good. And I like to see the insulin between 3 and 10 in a perfect world, between 3 and 10. If it's below 3, it doesn't necessarily mean it's bad. It just means there may be an issue going on that we need to discuss. And if it's above 10, that's a sign of potential impending insulin resistance, which can lead to type 2 diabetes, because that's what type 2 diabetes is when your insulin becomes resistant. It can't work anymore. It doesn't work as effectively. So it becomes resistant, and that's type 2 diabetes. If your body's not producing insulin at all, that's type 1. So I truly worry if your insulin is 0 and your blood sugar is sky high. That means there's type 1 diabetes. If your insulin is high and your blood sugar is high, that's more of a type 2 diabetes look. But you'll notice in this example, both are what I would call perfect. So hemoglobin A1C is 5.3, within that 4.5 to 5.4 range. And then the insulin's about 3. Again, I like to see it between 3 and 10. So diabetes or prediabetes is not this person's issue. But if you have a high hemoglobin A1C and a high insulin, which is generally what I see, that's a sign of insulin resistance and type 2 diabetes, and that needs to be addressed immediately through diet, exercise, and potentially supplementation and potentially medication. Comprehensive metabolic panel. So in the comprehensive metabolic panel, we're looking at a lot of different things. We're looking at liver, kidney, electrolytes, bones, muscles, and let me take you through all the different things we're seeing in this comprehensive metabolic panel. So sodium, potassium, chloride, these are electrolytes, what make your muscles move and what make electricity move through your body, right? We all know Gatorade or elements, or there's a lot of different things that we can add to our water, salt, sodium chloride is stuff that is pretty famously known as electrolytes. So we want to make sure your electrolytes are all good. So sodium, potassium, and chloride are all checked pretty much in every blood panel. Carbon dioxide, or what we breathe out, lungs. Also, it can affect the pH balance of your blood. So we want to make sure that your carbon dioxide is good, not only to make sure your lungs are working effectively, but to make sure the pH balance of your blood is good. Because again, if the carbon dioxide is high or the carbon dioxide is low, that could mean there's a lung issue, there's a breathing issue, or there's a pH balance issue. And I'll tell you, sometimes it just happens. Sometimes we just catch people with an abnormal carbon dioxide. Same thing with electrolytes. you may have an imbalance of electrolytes. It doesn't necessarily mean you're doing anything wrong, but just like blood sugar, electrolytes can go up and down. Carbon dioxide can go up and down. These tests are very sensitive. So I catch people all the time with, slight imbalances in electrolytes or slight imbalances in carbon dioxide. And generally, if you're not sick, then it's probably a moment in time. If you truly had a electrolyte imbalance or a carbon dioxide imbalance, truly, you'd be very sick. I'm talking like emergency room or intensive care, sick. So yes, I understand that you're probably not feeling great. That's why you did this blood work in the first place. But if you have an imbalance in these two things, like a true imbalance, you'd be extremely ill. So more than likely, if you have an imbalance right now and you're not feeling extremely ill, it's probably a moment in time. But if we check your blood again and there's another imbalance, that's more of a sign that that's truly a problem. Glucose, or actual blood sugar at that moment in time. And you'll see that her blood sugar is normal at 87. In a perfect world, I'd love to see the blood sugar, low 90s, but 80s more preferably, or high 70s even. So, you'll remember that her hemoglobin A1C, her insulin was perfect, and her blood sugar is perfect. So again, this pretty much tells me with significant accuracy that diabetes and prediabetes is not her issue. If you combine glucose, hemoglobin A1C, and insulin all together and everything's good, that's a pretty good sign that it's not blood sugar that's your issue. The next 5 things, BUN, creatinine, eGFR, and BUN creatinine ratio, that block of 5 is pretty much your kidney markers, So BUN stands for blood urea nitrogen, and so it's looking at urea and nitrogen breakdown products in your blood. If you have high levels, that could mean that you have a kidney dysfunction, that you're not clearing byproducts or waste products effectively. Also, though, it could mean you're eating a lot of protein if it's high. Also, it could mean you're a little dehydrated. So just because a number is high does not necessarily mean your kidneys are failing or there's a problem. You have to put this all into perspective and you have to get the full story. But, and again, this is all a Google away. If you ever want to Google these things, there's great websites, there's great information out there about these specific tests. But remember, it's going to tell you all different types of things. So you have to put the whole story together. And generally, if there's one thing off, and you'll notice, in this example here, the creatinine was high. So, but her BUN's normal, her eGFR, and BUN creatinine ratio are normal. So if there's one thing out of the 5 that's off, generally that means it's a moment in time or it's something less innocuous than a kidney issue. If you truly had a kidney dysfunction, all of those things would be off. So that's another thing, again, when you're interpreting these labs, you have to put the whole picture together. So just something to be aware of. Creatinine. Creatinine is another marker for kidney health, but it's also a sign of muscle breakdown. So your muscles, when you work them, either through exercise or just activities of daily living, they're gonna break down and hopefully build back up. Right? Muscles, the whole reason we lift weights is so that we can tear our muscles down microscopically to build them back up bigger and stronger. But any type of activity will break down muscles and build them back. So you're always breaking down and building up. So sometimes I can catch people in a breakdown phase because this is how this gets measured. Your muscles break down, then they get pushed to your kidneys and then peed out. So if you have a high creatinine, it could be a sign that you have increased muscle breakdown. It could be a sign that your kidneys aren't filtering as well. Also could be a sign that you're eating a lot of protein. So there's a lot of different reasons why this could be high. Again, you got to put the whole picture together and make sure you're talking with a medical professional who can do that. But in this example, you'll see she's at 1.0, and that's not really concerning to me. That's not really concerning. When it starts getting above like 1.5 is when I start really getting concerned, or when the BUN or the eGFR or the BUN creatinine ratio starts getting out of balance, or you start having symptoms of kidney dysfunction, that's when I start to worry. So, a high creatinine could be dehydration. It could be a lot of different things. We'll talk more in depth about your specific issue moving forward. But, I like to see it below 0.9. But 1, 1.1, 1.2, still not super scary. I'll start to really worry if we're dealing with like a 1.5. eGFR, So that stands for estimated glomerular filtration rate. That's a mouthful sometimes to say. And again, the key word in that E, estimated, that's math. I think you remember me saying I don't like math in the human body, right? Because math is black and white, the human body's not. But it's, again, a marker that we can utilize to check in on kidney function. So again, the key word here is estimated glomerular filtration rate. Glomerular stands for glomerulus, which is the part of the kidney that filters. So this is an estimated filtration rate of the kidney. So you want to see this number above 60. I'd like to see it above 90 in a perfect world. But again, it's estimated, it's math. So as long as it's above 60, I'm pretty happy, especially if all other things are functioning appropriately. BUN creatinine ratio. So this is the blood urea nitrogen and creatinine ratio. And the most common reason I see this high, if it is high, and I don't worry about lows. If it's low, I don't worry about low. I worry about highs. And the most common reason I see this high is dehydration. Because when your blood's dehydrated, it's going to condense more. So it's going to look like there's more particles in it. So it's going to look like you have more urea and more nitrogen, more creatinine. So the most common reason you see these numbers elevated is dehydration. So just make sure you're drinking water and making sure you're staying hydrated. Calcium. Calcium comes from your bones. Calcium comes from the food we eat. So we want to make sure it's not too low. We want to make sure we're consuming enough and getting enough in our body. We also want to make sure it's not too high, that our bones aren't breaking down and releasing calcium into our blood. So you'll notice she's at 9.4, which is right in the middle. And I like this ratio. This reference range of 8.9 to 10.6 it's a pretty tight reference range, but I like this reference range. So I like to see these numbers within that reference range. I like tighter reference ranges. So that's a good reference range. I want to make sure it's not too low. Again, if it's too low, probably means you need to consume more calcium or consume more food in general. If it's too high, that could be a sign of osteoporosis, osteopenia, a breakdown of bones. So we'll look into that if it's high. Albumin is a protein that carries different materials in your body from place to place. So albumin is a protein, and again, protein is made naturally in the body, but also consumed from food. So this is a protein that carries different things from place to place. It's also a protein that helps hold water into cells, So you want to make sure you have enough albumin. And the way you make sure you have enough albumin is making sure you're eating enough protein and consuming enough food. If you have a high albumin, that could be a sign of liver dysfunction, could be a sign you're consuming a lot of protein. We'll have to make that, we'll have to figure that out when we sit down and talk. AST and ALT, or ALT and AST, are liver markers, liver enzymes. So if your liver is irritated or broken down for some specific reason, or you have fatty liver, or something's going on in your liver that's degenerative or a problem, these numbers will be high. And then we have to figure out what or why that's happening. So if your liver's breaking down, we have to figure out why. Is it alcohol consumption? Is it a virus like hepatitis? Is it bacteria? Is it fatty liver? We have to figure that out. And one thing that a lot of people do if they're seeing liver dysfunction is they may get an ultrasound of the liver and gallbladder, because that's also, gallbladder is another big piece of this puzzle too, because the gallbladder is attached to the liver. So if there's a gallbladder issue, there could be a liver issue because of that, and these numbers can get a little elevated. So you'll notice in this example, it's fine, no problem there. But if your numbers are high, then we have to figure out what's going on. Are you consuming something that's irritating your liver? Do you have a virus or a bacteria that's hurting your liver? Is there fat accumulation in the liver? What's going on? Is there a gallstone? Something's happening, and we just got to figure out what that is. Bilirubin is produced by the liver. It's also produced by the blood. It's a breakdown product. Helps with, it's also a product of bile. So again, it's all produced by the liver and blood. If these numbers are high, it could be a sign of liver dysfunction. It could be a sign of blood dysfunction. It also could be genetic. So there's a lot of reasons why bilirubin could be imbalanced. I don't know if you've ever heard of jaundice before, but when someone's jaundiced or yellow, that's a sign of high bilirubin in their blood. It can happen to children, especially infants, but it also can happen to adults. And generally, it's a sign of liver dysfunction or blood dysfunction. So if you have a high bilirubin, we'll definitely get to the bottom of that and figure out why. Protein total. So albumin is a type of protein, but there's also many other types of protein, globulin, sex hormone binding globulin. There's a lot of different other proteins in the blood. So and proteins carry things, they help build, they're building blocks. So it's really important that you have enough protein. So that's why it's so important to make sure you're consuming enough protein in food, but also it's important to have proper liver function, proper other nutrients to help build proteins. So we want to make sure your protein levels are good. And I like to see the protein levels above 7. Above 7 is ideal. So if you're at 6 or below, that's a sign that we may need to consume more protein. If you're above, that may be meaning you may be consuming too much protein, but it also could be meaning that we have some liver dysfunction or cellular breakdown or something may be going on there too. So we'll have to make that assumption or that determination when you come in for your visit. Alkaline phosphatase. Alkaline phosphatase is a breakdown product or an enzyme of the bones, muscles, liver. So if you see this number high, above 100, or high 90s even, I like to see it, in the 90s top level. I like to see it above 60 at the bottom level. So if you see it high, that could be a sign that our liver, muscles, or bones are breaking down faster than they're building back up. If you see it low, below 60, that's a sign of zinc, B6, and other nutrient deficiencies. So we want to make sure that we get those nutrients in your body to help preserve muscle, bone, and liver tissue, because those are really key to making sure those tissues stay strong and healthy. And then serum osmolality. Serum osmolality, what that basically means is, and I equate this to like oil viscosity, right? How thick is your blood? And so serum osmolality is a combination of all these different things: sodium, potassium, chloride, carbon dioxide, glucose, urea, nitrogen, all these different liver markers all combined into your blood. So if these numbers were all high, like if you had high sodium, high potassium, high chloride, high creatinine, if everything was high, the serum osmolality would be very high. If everything was low, the serum osmolality would be very low. So again, it's a calculation, not my favorite, but again, it's just telling me how much stuff is in your blood versus how much it isn't. Thyroid panel. So let's make sure before we dive into the thyroid panel that we just are speaking the same language from anatomy and physiology. So the thyroid sits here in your neck, and what communicates or how your brain talks to the thyroid is the pituitary gland. So the pituitary gland, which kind of sits right between your eyes here, which is a gland in the brain, calls out to the thyroid using TSH. So you'll see that indicated, in your blood work right there. So TSH goes down to the thyroid, and it then tells the thyroid to produce T4 and a little bit of T3, but mainly T4. So you'll notice T4. So T4 gets released from the thyroid, and then in the body, in the liver, in the muscles, in the tissue, in the gut, gets turned into T3. Again, the thyroid produces about 20%. So if out of 100%, almost 90% of what's produced by the thyroid is T4, about 10% T3. But in the body, in the tissues, mainly in the liver, in the gut, is where the T4 becomes T3. And T3 is the main thyroid hormone of the body. So of all the tissues, T3 is the most utilized of the thyroid hormones. And what does thyroid hormone do but control metabolism? And what is metabolism? All that really means is cellular energy, producing cellular energy. And people equate metabolism with fat. And it's true. If you have a poor metabolism, your cells can't work appropriately and your body becomes dysfunctional, and a dysfunctional body lays down a lot of fat as a protection mechanism. So it's a piece, metabolism is a piece of that, but metabolism really means cellular function. So you need to make sure not only that you have a properly working thyroid producing T4, but you also need to make sure you have good tissues, good liver, good gut, good nutrients to turn T4 into T3. So T3 is one of the most important thyroid hormone markers that we need to check and make sure is good. Okay, so the first thing we're looking at is free T3 in this example, and the T3 is 2.7. In a perfect world, I'd like to see it above 3, even to 3.5 or above, depending on how you feel. So 2.7 I would consider low. And most of the time when someone has a low T3, they're going to feel symptoms of hypothyroidism, right? Either they're gaining weight or have trouble losing weight, hair loss or weak hair, weak brittle fingernails, dry skin, fatigue, constipation. There's so many different things that hypothyroidism, so many different symptoms that hypothyroidism could present as. And their doctors for years have been telling them that your thyroid's normal because they've only looked at TSH and free T4. So we need to make sure that we're always looking at free T3. And if free T3 is low, we have to figure out why. And again, it could be a liver issue, it could be a gut, gastrointestinal issue, it could be a nutrient deficiency issue. Some of the most important nutrients that help turn T4 into T3, the more active form, T3, is zinc, selenium, copper, vitamin D, B vitamins. There's so many different nutrients that help turn T4 into T3, the more active form. So we need to make sure that all these nutrients are optimized in you. When you have a normal T4, that's telling me that generally your thyroid is working appropriately. Also that you have good zinc and good iodine levels as well. And also some other nutrients that are important to produce T4. So if you have a good free T4, it either means you're on the right medicine, if you're on thyroid medicine, or for T4, or your thyroid is functioning appropriately if you're not on medication. But again, T4 is just a piece. We really need to make sure that T3 is as good as it can be. And to make sure T3 is as good as it can be, we need to have good liver, good gut, good nutrients. TSH, again, is the brain calling out to the thyroid. So a normal TSH is telling me that the brain thinks the thyroid is doing an okay job. So if you have a high TSH, the brain is screaming or calling out aggressively to the thyroid saying, hey, work harder, produce more. If you have a low TSH, it's the brain telling the thyroid to put the brakes on that you're producing too much. So if you have a normal TSH, the brain thinks it's good. If you have a high TSH, the brain is telling you to step on the gas, work harder. And if there's a low TSH, the brain is saying, hit the brakes, you're producing too much, we're hyperthyroid, we're hyperthyroid. Anti-TPO. Anti means against, or an antibody. TPO stands for thyroid peroxidase. So thyroid peroxidase is what helps make T4 turn into T3, thyroid peroxidase. So if you have an antibody against TPO or thyroid peroxidase, this means your immune system is attacking your own thyroid, and it means that your body can't as effectively move T4 into T3. So this is something called Hashimoto's disease. So if you have a high anti-TPO, that's generally a sign of Hashimoto's disease. It also could be a sign of Graves. I've seen it high in Graves as well, but generally it's a sign of Hashimoto's. Reverse T3, when T4 breaks apart into T3, it breaks apart into T3 and reverse T3. And reverse T3 goes back to the brain and tells, hey, this happened, we don't need to work as hard. So the higher the reverse T3, the more the brain says, okay, things are happening, we can put the brakes on, we don't need to work as hard. So you want to make sure that the reverse T3 is good. And I do like that range, 7 to 23. Usually higher reverse T3 is a sign of stress, chemical, physical, emotional stress in the body. So this is a little, this example is at 20, so it's a little high normal, still normal, but it's a sign of there's some type of stressor going on, whether it be chemical, physical, or emotional, or a combination of all three. And then there's anti-TG, anti being against, TG being thyroglobulin. Thyroglobulin, if you remember, Globulins are a protein that carry things from place to place. So this is a carrier of your thyroid hormone. So if you have antibodies, if this is high, this is a sign that your body's attacking, again, the thyroid and not allowing your body to transport thyroid hormone throughout the body to the other tissues. And again, that's another sign of Hashimoto's disease. Also could be a sign of Graves', but more so Hashimoto's. So we have our thyroid. Our brain tells our thyroid to produce T4. Then TPO comes in and turns it into T3. T3 then gets carried along with T4 with thyroglobulin to the place it needs to go. So if there's any dysfunction in any of this stuff that's happening, you have a thyroid issue and that we need to fix, and your body's going to have symptoms. Remember, it could be a thyroid issue, but it also could be a gut issue, a liver issue, or a nutrient issue that's causing your thyroid to be dysfunctional. So that's why we need to look at all these pieces, and we need to test deeper. If we do find a problem, we need to figure out what your nutrient levels are, how your liver is functioning, how your gut's functioning, and we need to figure out what is triggering your body to produce antibodies or soldiers or fighters against your own thyroid. And that's our true mission, and that's what we're going to figure out as we continue through this program. Other hormones. So your thyroid is a hormone, but there's so many other hormones. There's 50 major hormones in your body. And while we're not looking at all 50, we're looking at the majority of your hormones here, some of the most important hormones. So let's go through this kind of line by line and make sure you understand what these hormones are doing and why they're important. And just an important note is that men, women, children, doesn't matter your gender, we all have the same hormones, it's just different ratios. Women should have higher estrogen, men should have higher testosterone, but men have estrogen, and estrogen is just as important to a man as it is to a woman, and women have testosterone, and testosterone is just as important to a female as it is to a male. It just, you don't want your testosterone to be too high as a female, you don't want your estrogen to be too high as a male. So these hormones are all the same, men, women, children, all the same, just the ratios and amounts should be different. So again, this is a female, but I'm also going to address male levels as well. So first thing we're looking at on this page is estradiol, which is one of 3 different types of estrogen. And if you go down the page a little bit, you're going to see closer to the bottom, you're going to see estriol and estrone. So those are the other 2 types of estrogen. Estradiol is kind of your main estrogen, the main estrogen of men and women combined. So this woman in particular is a cycling female, meaning she has not hit menopause yet. So depending on where she is in her cycle, cycle being, again, her period, if she's on her period, her hormones should be a lot lower. If she's ovulating, they're going to be a lot higher. So I'm willing to bet, and when we talk, she'll tell me exactly where she was in her cycle. I'm willing to bet she was ovulating because her estradiol is about 216. And that's pretty high for a woman. A low mark, I'd like to, probably see around 30 to 40. That's either postmenopausal. So if you're postmenopausal, I'd like to see your estrogen at about 30 to 40. If you're not postmenopausal, if you're a cycling female, during your period time, I'd want to see your estrogen at about 30 to 40. Ovulation, about 100, 150, 200 range, depending on the person, right? So that's kind of what we're looking at. Again, postmenopausal, you're going to kind of be 30 to 40 across the board. You don't have a cycle anymore. But then again, if you're a cycling female, if you're not menopausal, you're going to bounce up and down depending on where you are in your cycle. And I'm assuming in this example here that this person is ovulating with those numbers. If she's not ovulating though, you say she was on her period, that's a bad sign that her estrogen is that high because it shouldn't be. So that's a problem. If your hormones, there are times where your hormones should be high and times where your hormones should be low. If that's not the case, and this is why you need to get the whole picture, and numbers don't tell the whole story. You need to make sure that you know exactly what's going on in someone's body when you're addressing these hormones. But if a woman's on her period and her estrogen is 216, that's a big problem. That's a sign that your hormones are drastically imbalanced. Now, if she's ovulating, that's a little bit more normal. Still a little high. I still consider this a little high even for ovulation, but that's something we'll address in the visit. FSH stands for follicle stimulating hormone. This is a sign that the brain, so this hormone comes from the brain and calls out to the ovaries in women, in the men, testicular, right? Oh, and let's go back real quick just to make sure we address this. Estrogen for a man. I'd like to see estrogen for a man in the 30s to 40s. So that's the difference between men and women, right? You know, again, estrogen is present in women and men. For a woman who's on her period, I'd like to see it about 30 to 40. Ovulation, 100, 150, 200. In a man, I'd want to see it at about 30 to 40. Again, we're not cycling. Men don't cycle. So I mean, they may a little bit, but generally about 30 to 40 for a man, estradiol. Same with FSH. So men, women, children, we all have the same hormones. So FSH is another thing in all of us. And again, in women, the brain calls out to the ovaries to produce eggs. In men, it calls out to the testicles to produce sperm. So this number goes up and down, and you can see on the bottom of this page, you can see some reference ranges, more so for women, of when your body's producing an egg, when you're ovulating. When you're ovulating, this number is going to be a little bit higher, as opposed to when you're, on your period, it's going to be a little lower, or when you're in menopause, it's going to be different too. So we'll talk about these. And this is a marker for menopause. When this number gets pretty high, it's a sign of menopause. So some doctors will tell you, I can tell you're in menopause from your blood work. Well, how do they know that? This is what they're testing. If this number gets really high, it's a sign of menopause. DHEA is a precursor to testosterone and estrogen. So I look at this number in men and women. I'd like to see it above 100, if not 150. I want to make sure, both in men and women, that it's about at least 100, 150. And sometimes in men, I'd like to go as high as 200. And sometimes in women, I'd like to go as high as 200. So about 100 to 200 is kind of where I'd like to see this. You'll notice in this example, she's at 311. So this hormone, again, is a precursor to testosterone and estrogen, but it's made in the adrenal glands. So when this number is high, this could be a sign of adrenal stress. So the adrenal glands is where hormones for stress and hormones for energy come from. So this can be a sign of adrenal stress. So DHEA is a marker I look at to make sure your body's producing testosterone and estrogen effectively, but I also look at it as a marker for adrenal health as well. So if you're below 100, that's a sign that it's low. If you're above 200, that's a sign that it may be a little bit high, but we're going to put that whole picture together based on your visit. LH stands for luteinizing hormone. This is another hormone produced by the pituitary gland, calling out to the ovaries, or in women and in males, testicles, to help the production and the release of eggs, or the production and the release of sperm. So this is just telling me in males and females if you're still fertile or not. Sex hormone binding globulin, or SHBG, sex hormone binding globulin, are the ships that carry the hormones from place to place. So we have to make sure if there's a hormone dysregulation in your body, we have to make sure, is it a production issue or is it a shipping issue? So remember, these are the ships that carry the hormones from place to place. So if you have low ships, if the SHBG is low, that means your body is not producing enough ships to carry the hormones from place to place. And that's a problem. That can make you feel like you have low hormones when maybe your hormones are normal, they're just not getting shipped from place to place. If you have a high SHBG, that's generally a sign that your hormones are low and you have too many ships and not enough passengers. So we need to increase production, increase passengers to fill the ships. So we're always looking at this number just to make sure it's not a shipping issue. Because if it is, we'll address that in different ways. Cortisol is most famously known as the stress hormone, and it's produced by the adrenal glands. Now, it's important to test in the blood, but it's not the ideal way to test it in the blood. This is a one-time look at cortisol. To really test cortisol, you would want to test it multiple times, like 5 to 6 times in one day in your saliva. Also, another way to test cortisol effectively is to do a 24-hour urine test. So you'll notice that this cortisol is normal, but if you're coming to me saying, I'm stressed out all the time, I'm gaining weight in my abdomen, I'm gaining weight in my face, I'm gaining weight in my back, I can't put on muscle, my bones are falling apart, I can't sleep at night, I would not trust this to be the end-all be-all answer of your cortisol. I would want to get a 5-point to 6-point saliva-based cortisol test to look more at a 24-hour range, or at least a 24-hour urine of your cortisol to make sure. So blood testing is important, right? And if you're super high or super low, that'll tell me something, but it'll tell me to go dig deeper with the saliva or the urine. But even if it's normal, I wouldn't treat that as gospel, especially with symptoms and other signs. So we'll discuss this. If you're normal but still feel as if you're stressed out and your body's not responding appropriately, we may still do some testing moving forward to truly look at that, because the saliva testing and the urine testing is a better way to look at that. Testosterone. Again, men, women, children, we all have the same hormones, just different levels, and we all have testosterone, and testosterone is super important. You know, everyone thinks of testosterone as muscles and sexuality, but it does so much more, 400 different things more. It has to do with brain health and skin and heart health and immune system. It does so many different things outside of muscle tone and libido. So it's hugely important, and we got to make sure it's all good. And there's 3 types of testosterone that we're looking at here. We're looking at total testosterone, free testosterone, and then second to the bottom on this page is dihydrotestosterone. So we got to make sure all those are good. So in a female, I'd want to make sure that your testosterone is at least 30, 40, 50. That's kind of where, 30 to 50 is where I'm looking at. For a female, your free testosterone, I'd like to see it at about 1, at least 1. And for a female dihydrotestosterone, I'd like to see it at about 25. So you'll see in this example that she looks good when it comes to total testosterone, but her free testosterone is pretty low. And the free testosterone is really the usable testosterone. So if you have low free testosterone, you're going to feel as if you have low testosterone, even if your testosterone, your total testosterone is normal and your dihydrotestosterone is okay. If you have low free testosterone, you're going to feel as if you have low testosterone. And again, that's trouble with weight, putting on fat, not being able to gain muscle, low libido, brain fog, just feeling overall fatigued. And just to give you an example of the difference between men and women, I'd want to see testosterone in a male at about 600 to 800. So that's the difference between men and women. A woman, I'd want to see 30 to 50. A man, I'd want to see 600 to 800. So that's the difference between men and women. For a male, free testosterone, I'd want to see it about 20. So remember, woman, I'd want to see it at 1. A man, I'd want to see about 20. And then dihydrotestosterone, I'd want to see, at about 35 to 50 dihydrotestosterone in a man versus a woman. So that's the difference between men and women when it comes to, testosterone. So I want to make sure that we raise this person's free testosterone. And there's a lot of ways to do that. Lifestyle, which includes diet, exercise, all these different things, supplements, and sometimes it means putting someone on testosterone or something that stimulates testosterone. And again, it's very dependent on what else is going on, your goals, your wants, your needs. So we'll have that conversation. But we want to make sure that we raise that free testosterone. Next, we're going to look at progesterone. So when you're looking at hormones, it's important to understand that hormones all work together, specifically estrogen and progesterone. So anytime you're looking at estrogen, and that's estradiol, estrone, any of the estrogens, you want to make sure you understand what progesterone is doing, because it's kind of the yin and the yang. It's the opposite. Estrogen is kind of this go, energy-producing, brain-stimulating hormone. Progesterone is kind of the opposite, calming, relaxing, brain calmer. So we want to make sure that they're in balance. If estrogen's really high and progesterone's really low, you're going to have symptoms. If progesterone's really high and estrogen's really low, you're going to have different symptoms. So this estrogen, when estrogen's high, that's called estrogen dominance. and then there's progesterone dominance. So we want to make sure they're balanced. And in a perfect world, I'd want to see for every 10 estradiols, one progesterone. So a 10-to-1 ratio, estradiol to progesterone. So you're going to notice in this example, her estradiol is 216. So in a perfect world, her progesterone would be around 18, 19, 20. And you're going to see her progesterone at 6. So in my mind, this is very estrogen dominant. And when you're dealing with estrogen dominance, more than likely you're going to experience symptoms such as heavy painful periods, trouble losing weight in the butt, hips, and thighs, breast pain, nipple pain during periods, more emotionally irritable during periods. Also having trouble turning your brain off just all the time, constant worry, constant agitation, trouble sleeping, ADHD, things like that. Potentially history of miscarriages. There's so many different things that could happen when you're estrogen dominant. So this is definitely something, and more inflammation. Estrogen can be very inflammatory to the brain and to the body. So there's a lot of different things that can go on when you have a lot of estrogen without the progesterone backing. So one thing in this person that we're going to talk about is trying to get that more balanced, trying to lower the estrogen load while we're raising the progesterone. And there's a lot of different ways to do that. Again, lifestyle, supplements, medications. There's so many different ways and so many different possibilities. But to do this effectively, you need to fix gut, you need to fix nutrients, you need to fix hormones, you need to get rid of toxins, you need to lower stress levels, you need to do multiple things to make sure this happens. Even if you're going to choose a medication route, you need to make sure that all the other things are working appropriately to get that balanced. So again, estrogen, there should be 10 estrogens for every 1 progesterone, and I want to make sure I get as close to that ratio as possible. Parathyroid. Parathyroid are 4 glands that sit behind your thyroid, and they help regulate bone density and calcium levels and to some degree vitamin D. So they help regulate bones and nutrients and absorption and things like that. So if you're dealing with severe osteoporosis, it may be a parathyroid issue. If you're dealing with calcium level imbalances or vitamin D level imbalances or things like that, it may be a parathyroid issue. So it's something I like to check in everyone just to make sure I'm not missing anything. Again, we have estradiol and estrone. Again, these are different types of estrogens. Estriol, I apologize, estriol is more, you'll see this a little bit higher in pregnancy, in postmenopausal. So, again, it'll be a little bit lower in a woman who's menstruating. And then estrone is more of an inflammatory type estrogen. It's important, it's necessary, but you don't want to see it too high because it's more of an inflammatory type estrogen, more linked to potential breast cancers and uterine cancers and ovarian cancers. So we want to make sure this number is a little bit lower or not too high. Prolactin is another hormone produced by the pituitary gland. It's most famous for producing breast milk in women when they are pregnant, but it also helps regulate a lot of other things. And something I generally see is when cortisol is high, prolactin is high, and when cortisol is low, prolactin is low. And when cortisol is normal, prolactin is generally normal too. It can help regulate mood. It can also help regulate testosterone levels and estrogen levels. It helps regulate other hormone balances, things like that. So it's just another important marker to know. If it's high, it's generally a sign of stress and irritation in the body. Again, if you Google it, a high prolactin is linked to a pituitary tumor called a pituitary adenoma. So if you see a high prolactin level, that may be something we talk about. Generally, I see a prolactin level above 100 if it is linked to a potential tumor in the pituitary gland. Dihydrotestosterone is a breakdown product of testosterone, and we talked about kind of those levels being about 25 in women and closer to 50 in men. I want to make sure that you have a breakdown product of testosterone. This is a very active form of testosterone, so we want to make sure that it's not too high, but also not too low. And then pregnenolone is a hormone that can kind of turn into any hormone. It's like a hormone chameleon. It's also known as the mother of all hormones because it's produced in the adrenal glands, but it can turn into testosterone, it can turn into estrogen, it can turn into prolactin, it can turn into progesterone, it can turn into anything. So it's really important to know this number. It's also a sign of adrenal health. So we want to make sure, and you notice it's a little high, so that kind of goes in tandem with DHEA being a little high. So again, a sign of potential adrenal stress. So that's good to know. If it's low, generally I see people having a little bit of brain fog and brain fatigue with low pregnenolone levels. Too many P's, pregnenolone levels. So this is, again, it helps me, having all these hormones laid out helps put the picture together as to what's going on. But even more important than these numbers is what you're experiencing. Because these numbers can vary, these numbers can change. These numbers are very important and very eye-opening to me, but I need to put these numbers in tandem with how you're feeling and what you're experiencing in your body to truly give you the best care possible. CBC, or complete blood count, looking at white blood cells, red blood cells, and platelets. White blood cells fight infections, red blood cells carry oxygen, nutrients, sugar, and platelets help with healing and coagulation. So this is looking at all the different types of white blood cells, different size, shape, production of red blood cells, and size and shape and production of platelets as well. So white blood cells, or WBCs, are kind of the first thing you see. This is looking at your general immune system. We don't want to see it too high. We don't want to see it too low, because that can be a sign of indwelling problems. But also stress, like high levels of stress can cause white blood cells to rise. So you don't want to see white blood cells too high, which is a sign of stress or bacteria or virus or something's happening. But also too low means your body can't fight. So we always are keeping an eye on these to make sure your immune system is functioning. Red blood cells, again, carry oxygen, nutrients, sugar in all kinds of different products in your blood. So we want to make sure that that's good, because they're transporters. So if it's too much, though, if there's a sign that there's too much stuff in the blood, there's a dysfunction, that's a problem. If there's too little, again, that's a problem, because you can't transition oxygen effectively. You can't transition iron or other nutrients effectively too. So that's why red blood cells are important. Hemoglobin is the color of the blood cells. You don't want it to be too dark. You don't want it to be too light, because that's a sign of how well they're transporting oxygen and how effective they are. So, and there's a lot of different reasons why it could be too high or too low. So we'll talk about that more individually during your visit. Hematocrit is the thickness of blood. You don't want it to be too thick. You don't want it to be too thin. One of the most common reasons I see thick blood is sleep apnea. So something to consider if you have thick blood is are you having trouble breathing? Cigarette smoke, high altitude, there's a lot of different things that can cause thickening of the blood because of oxygen dysfunction. But if you don't smoke and you're not new to altitude and you see a thick blood, sleep apnea may be an issue. So you might want to look into a sleep study. And sleep apnea is a big continuum. So just because you don't snore like a train or have a really thick neck, or if you don't have those things, doesn't mean you don't have sleep apnea. So something we may talk about in our visit, if you have thick blood, is getting you a sleep study. And sleep studies are very easy nowadays. And also, you're not doomed to a CPAP machine if you do have sleep apnea. There's a lot of other things that you can do moving forward, in today's day and age. MCV stands for mean corpuscular volume, or average cell volume. It's like how big is your cells. The bigger the cell, again, the harder it is to transition nutrients effectively, and the smaller the cell, the harder it is to transition nutrients effectively. So you don't want it to be too big or too small. One of the biggest reasons I see this high, if you have a high MCV, is thyroid dysfunction and B vitamin deficiencies. So if you see a high MCV, those are two things that we're really going to rule out. There's other reasons too, but those are the two most common. MCH stands for mean corpuscular hemoglobin, or average cell color. Again, it could be high, it could be low, and there's a lot of different reasons why that can be high or low. MCHC stands for mean corpuscular hematocrit, or average cell thickness, average cell consistency. Again, a lot of different reasons why it can be high or low. We need to put this all together in a picture to really get ideas. RDW stands for red cell distribution width, and this is how well your bone marrow is producing blood cells. One of the most common reasons I see this high is sleep apnea or anemias of some type or blood loss. Your body's trying to produce more cells to help compensate for an issue. So if you see a high or a low, that could be a sign that your bone marrow is either working overtime or not working effectively. So we'll get to the root cause of that and why. Platelets, again, are what help heal and stop bleeding. If you get cut, the reason you stop bleeding, there's a lot of different factors that play into this. Platelets are one piece of that puzzle to make sure that you don't bleed too much. Now, if your platelets are really high, there's an increased risk of clotting, so we want to make sure we figure out why that is and address a root cause to make sure you don't clot when you shouldn't. Neutrophils, lymphocytes, monocytes, eosinophils, and basophils, and immature granulocytes, all those things, those 6, are all different types of white blood cells. And if you look, all those different white blood cells have a percentage, and all of them have a count. So something I will tell you is I don't pay that much attention to percentage. I do a little bit, and it's important, but I pay more attention to count. I pay more attention to count. So we'll look at the percentages, we'll talk about the percentages, but something you've heard me say already multiple times is that's math, and I don't like math in the human body. Math is black and white, math is numbers. The human body is not black and white, it's very gray. So we want to make sure we're looking at direct numbers. So I pay more attention to the actual count of those things. And each white blood cell, and we can talk more, if we need to about this, and you can feel free to look this up, but each white blood cell kind of fights a different thing. Neutrophils fight more bacteria, lymphocytes fight more virus, monocytes fight more inflammation, general inflammation and allergies, eosinophils fight more allergies and parasites, basophils, again, more general inflammation type things, and immature granulocytes are baby white blood cells. So if you have high immature granulocytes, it's a potential sign that there's kind of overwhelming amounts of stress that you need to push out babies to fight. Your bone marrow is pushing out, and your immune system is pushing out babies to fight this problem. So if you have immature granulocytes, it's a sign that your body's dealing with a significant issue, significant stress, significant virus, bacteria, allergies, something's happening that's making your body feel overwhelmed. So immature granulocytes is kind of a sign of overwhelm, in the body. MPV, or mean platelet volume, how big are your platelets? And from time to time, I see this high in people. You'll notice this in this example. Her mean platelet volume is a little high normal, and that can be very normal in people, and that can be from time to time. So it's something I would test multiple times to see if you have a problem. But as long as your platelet count is normal and your mean platelet volume isn't that high, there probably isn't a problem. Nucleated red blood cells, that's again baby red blood cells. Again, that's another sign of significant stress that your body's trying to keep up with loss of blood cells, or that your body's trying to compensate for something. And again, that could be a sign of a massive stress, again, chemical, physical, emotional stress. So we'll talk about that if that's a problem with you. Other markers that we check just to make sure we're not missing anything: total IgG. Total IgG is another antibody that fights antigens. So this is kind of what I call your long-term immune system. And then IgM, which is another antibody, is more your short-term immune system. So happening right now, right? Something invades your body, something, you get stuck with something, you get stung by a bee, something happens. This is your immediate response. And then after the immediacy of the problem wears off, your body then says, okay, I want to make sure that doesn't happen again, or if it does happen again, I want to be ready for it. That's where IgG comes in. And this is the whole principle behind vaccinations. You get vaccinated for something to produce an immediate response, and then if it ever comes back again, that's when your body can respond more effectively. And so that's IgG. IgG is more the long-term, IgM is more the short-term. So if you're dealing with highs or lows in these things, this kind of points me in the direction of, is it new? Is it consistent? Is it chronic? What's going on with your immune system? And is this something new or something that's been going on for a long time? Uric acid is a breakdown product of protein, breakdown product of purines. Too much uric acid has been well associated with gout. But high uric acid is just a known inflammatory problem. And I like to see uric acids below 5. So you'll notice in this it is below 5, which is good. So anything above 5 is concerning to me. High uric acid just perpetuates inflammation in the body and causes more problems, just generalized problems. So if you have a high uric acid, you may not have gout, but you'll generally have other problems. And high uric acid has been very associated with certain foods, but also with high blood sugar. So we'll get rid of certain foods in your nutrition plan if you have high uric acid, and we're also going to really focus on lowering just other inflammation markers, but blood sugar is going to be a big factor. Magnesium, another nutrient or mineral that does 400 different things in your body that I really want to make sure is good. And I like to see magnesium above 2. So you'll notice in this example it's 2.3, which I think is great. But this is blood magnesium, and then there's cellular magnesium. So if you have symptoms, if you Google low magnesium and you feel you have symptoms of low magnesium, or if you present to me with symptoms of low magnesium, then I may recommend that we do a cellular magnesium check, because just because you have high magnesium in your blood doesn't mean it's actually working effectively. And this is true for all nutrients. Are your nutrients going into your cells and working appropriately? These are different tests, and these are different, deeper studies that we may need to do moving forward. So this magnesium looks good, but if you have any symptoms of low magnesium, which are very general, you may want to do some deeper study. GGT is a liver gallbladder marker. So if you remember this person, we tested multiple liver markers in her comprehensive metabolic panel, and they were all normal. And this GGT is normal, which again is a great sign that the liver gallbladder, or at least the bile system, is working appropriately. If you're high, then I may recommend we do some further study, either an ultrasound or some other studies to check in on that. Another thing that can make this high is alcohol consumption. So if you drank alcohol the night before a blood test, this may be high. LDH, or lactate dehydrogenase, is a sign of muscle and bone breakdown. So if it's high, it's a sign that your muscles and bones are breaking down too fast. Again, a sign of osteoporosis. Also liver, it's a sign the liver may be breaking down. Bones, muscles are all breaking down too fast. If it's low, that's a sign that your bones and muscles may not be breaking down enough, meaning that we may need to incorporate some more resistance exercise into your routine. So if you see a low LDH, one of the most common reasons I see this low, and this isn't true in everybody, but in some people it means that we're not stimulating our bones and muscles effectively to have them grow appropriately. Total IgE. This is an antibody that is associated with allergies and histamine release. So if we see this high, this is a sign that you have potentially multiple allergies to foods, to environmental products, dogs, cats, trees, weeds, but also foods. So if we see this high and you're really curious as to what you're allergic to, we can do some deeper testing and kind of break this down into specific things. But this is kind of a general panel that's kind of telling me, yes, you do have multiple allergies. Even if you're not feeling them, even if they're not terrible or they're only terrible at certain times, it means it's there and it's producing more inflammation and producing more irritation in your body. So it's something we will address and talk about and see if we can help optimize in you. Thank you so much for listening to this video. If you have any further questions, please feel free to contact us at 720-428-8312 or Trivita Functional Medicine online.